I've done this a million times. Okay, wonderful. Good morning and welcome everyone. You probably all will have just had a little note that said that this is being recorded. And so it's going to be shared the link for everyone who wasn't able to attend live. So just if you got the recording there, that's what that is about. And yeah, so just good morning. Thank you so much to everyone for joining and being here and joining our communities. I am so excited to be welcoming you to my first virtual class on nutrition and mental health. And we've had over 170 people join us, sign up for this event from all over the world, just in the last sort of week and a half, 2 weeks that we've been promoting this event. So it clearly is a very hot topic and something that people know it's very important and is of great interest. So hello to everyone who's here live, and for a lot of you I know who are watching the replay because you weren't able to join us live. Thank you for being here and connecting with us today on this very important topic. For those of you who don't know me, I'll just take a moment to introduce myself, and then I will turn it over to our guest speaker, Dr. Bonnie Kaplan. So I earned my PhD in health psychology from the University of British Columbia, and I'm very passionate about holistic approaches to digestive health, which really stems from my own struggles with healing from celiac disease and IBS. I was diagnosed with celiac disease almost 11 years ago now, and in that time and even before that had a number of different health complications that really all had to do with digestive health and wellness. And the state of my gut. And so I just know how important it is to get your gut feeling well from a personal perspective. And then my research over the last decade has really focused on the psychological aspects of coping with chronic diseases. So I focused on designing, testing, and evaluating strategies to help people who are really struggling. Not just to cope, but ultimately to feel their best and to live their best lives possible, because it is possible. No matter where you're starting, no matter how much you're struggling, you don't have to stay there. And so I recently finished my CHR-funded postdoctoral fellowship at the University of Calgary. And in this area of research, I focused on the mind-gut connection and how self-compassion is particularly helpful for people who are struggling with digestive wellness and a variety of different aspects of chronic health issues. And now I love running virtual one-on-one and group health coaching to support people on their wellness journey. And if you want to learn more about what I do, you can see my website link at the bottom there. Dr. Kaplan and I have a number of overlapping interests in digestive wellness and mental health. And so I'm so excited and honored to be hosting her today. If you have any questions throughout this talk, please type in the chat box and I will read them out at the end. Dr. Kaplan has time set aside at the end of her talk where we'll get to as many questions as possible. And so now on to our guest speaker. Dr. Bonnie J Kaplan is a professor emerita in the Cummings School of Medicine at the University of Calgary. She has published widely on the biological basis of developmental disorders and mental health, particularly the contribution of nutrition to mental health. Her efforts to include nutrition knowledge in the care of people with mental health challenges led her to write The Better Brain with her former student, Julia Reckledge. And so without further ado, welcome Dr. Bonnie Kaplan. We can't wait to hear your talk on nutrition is the foundation for your mental resilience. Over to you.
Okay, thanks so much, Justine. Now I'm going to share my screen. Are you turning yours off?
Yes.
Okay. And there we go. It's lovely when technology works. And I just need to shrink this so I don't have to watch myself. But I assume that all of you can see me, and welcome. I'm delighted. I've known Justine, I don't know how many years, actually quite a few years. But when she suggested doing this, I couldn't quite imagine how we could work it out because I'm not that focused on the gut. I'm much more focused on nutrition in the brain, but this is the topic for my talk, and you'll hear a little bit about the gut. And if you want to know more, I think you'll have to talk to Justine. So my topic is nutrition is the foundation of your resilience. And it seems like a silly title to me because it's been known for millennia. People have always known, going back many, many years. It's why we try to make sure people who are refugees are fed, why it's the highest priority for people who are displaced due to crises of floods and fires, etc. But I'm going to present it to you in a slightly different way. This is a traditional slide I have to show at all times. If I mention any companies that are manufacturing natural health products, and I don't know if I will yet, it'll depend on the questions, but I am not affiliated with any company or the sale of any product, and I never have been. So this is the book that Julia and I just published. Julia is my former student. She's a Canadian, but she has been in New Zealand for about 20 years now. She's on the faculty of University of Canterbury in Christchurch, New Zealand. And as you can see from the subtitle, it covers a lot of mental disorders. And the foreword is by Dr. Andrew Weil. So I want to start out by talking to you about why. Why write the book? Well, I have to tell you, it's been at least 10 years of friends saying to me, Bonnie, you've got to write a book. You have a unique take on this. We don't see it anywhere else. You've got to write a book. And I had a pat answer. I always said, I don't have a book in me because I'm an empirical researcher. That's what I spent my career doing. But when I retired from the university, from running studies, et cetera, although I'm still affiliated with them, but when I retired, I could no longer say that. I couldn't say that I'm an empirical researcher. So I looked around and I thought, you know, there are a lot of aspects of why that are still not answered. And maybe it is time to write a book. And I really twisted Julia's arm to work with me. Why? Well, first of all, I'm tired of nutrition books. I'm starting to call them the shake the finger books. You know, they're the ones that say, eat this, don't eat that. They never tell you why. They never tell you what the nutrients are doing in your brain. They're just saying, this is the way it should be done. And most of the time, they're not written by people who actually have done the research. So I've started to think about what does it take to engage people in being motivated to change their behavior. And I think it is buried in that question of why. They need to know why. Understanding what the nutrients actually do in our brains. I think that has motivated a lot of people who have listened to me give lectures. And then also learning that the evidence base for treating mental health problems with nutrition is really, really large. The general public does not know about it. Most of the public just knows about the magic bullet studies. Oh, take, omega-3s. Oh, vitamin D is good for you. Oh, but what about all the other nutrients? They don't know why these things are helping our brain function. So a lot of this talk is really devoted to why, and this is what led me to write that book. So this is an overview of the 3 topics. I have to show you that nutrition is related to mental health because some of you might not be aware of it. I have a very mixed audience here. Secondly, I have to review some information regarding mechanisms. I call this the section of what all of us should have learned in elementary school, but we didn't. Why? And by the way, they should also learn it in medical school, and most don't. And the third topic is why this knowledge should influence policy and mental health treatment. Excuse me. Sorry. And the $sign is very relevant here. Here in Alberta, it is said that our Minister of Health will very soon be identical to the Premier's job because more than 50% of our budget is for healthcare. And now that includes physical healthcare, but as we all know, it's mental health care which is the fastest growing in terms of the burden on all of society's budgets. So I hope all of our latecomers have come in. They missed just an overview. Now let's get to it. This is the most upsetting information that I have encountered in the last decade. The Canadian Community Health Survey, from their survey across Canada of 2004, so the data are not even that new, was published in 2017 asking the question, well, what are people eating? And they found that more than half of the food consumed in Canada is ultra processed. I don't even like to call it food. Food is stuff which builds cells and enables our cells to function. And more than half of what we are putting in our mouths does not qualify as food. It's not contributing to brain growth or brain function. This is replicated in the US. It's probably true in all of Western society. So you've got to look at that and ask yourself, well, what happens when people cut the other nutrients out of their diet, the ones that really enable our cells to function? And I need to give you a little definition here. I want to distinguish between macronutrients and micronutrients. And although there's a general consensus on what a macronutrient is, micronutrient, that term is used a little idiosyncratically. So a macronutrient, you know what these things are. It's the proteins, the fats, the carbohydrates. And so ultra-processed food often has all or some of those macronutrients. It has some proteins, it has some fats, usually not the best fats. It has a lot of carbs and hardly ever the good carbs. It's usually very refined carbs and the sugars. So what it's lacking, though, are the micronutrients. And I'm going to use the term micronutrient to refer to minerals and vitamins and maybe essential fatty acids. But as I say, especially if you get into the agricultural world, they use the words differently. So now let's look at this slide. Sit back and ask yourself, what is going to happen to a population which is voluntarily cutting back 1/2 of the vitamins and minerals that our grandparents consumed? And we actually have the answer. But the general public doesn't know this. So here's the question, and here's the answer. This is from the Minnesota starvation experiments that followed World War II. They had in this particular, they did a lot of studies, but in this particular one that focused on mental health, they had 36 normal healthy men, and they were cut down to 50% of their normal nutrient intake and also caloric intake. So it's not exactly the same. And because our people are getting lots of calories, right? They're just not getting the micronutrients. And this is what emerged: depression, anxiety, and inattention, one of the cardinal symptoms of ADHD. So we've known for a long time exactly what will happen when you cut back by 50%. But our general public, I don't think, does know that. And so we kind of treat our kids to poor food, and we let our kids go off to university and consume just pizza and soda and what is that kind of soup that people buy that's just got nothing in it. So I now want to go forward and tell you, because I can't cover all that much today in just 45 minutes, actually less than 45 minutes. I want to cover an overview of the 4 kinds of research. We go into it in a lot more detail, of course, with a lot of anecdotes in our book, but I want you to come away from this talk knowing that there are 4 kinds of research which actually are very solid for proving the importance of nutrition for mental health and how we could be avoiding a lot of the mental health problems that we have. So the first kind of research, I'm showing you just one slide on this, and it's a summary slide. And what it is telling you is that from many countries in the world, from Australia, Spain, Belgium, etc., studies have shown that people who consume primarily a whole foods diet, we sometimes call it a Mediterranean kind of diet. Excuse me for, I'm going to pause this. I don't know if you can see this, Justine, but we have someone having difficulty joining. The name keeps popping up. I don't know if you're watching that or not.
Yeah, I'm on it. Yeah, I got it.
Okay, it's come in 3 or 4 times. Yeah.
Yeah.
Okay, sorry. People who consume a Mediterranean whole foods kind of diet are likely to have lower rates of mood and anxiety symptoms. People who consume a Western processed foods diet have higher rates of mood and anxiety symptoms. There are so many correlational studies like this, way more than these 15 that are population health. So many, we should stop funding them. We should stop doing them because they don't prove causality. But the second kind of research we have really does prove causality. And this might be probably the most interesting for people in this audience who maybe want to know about prevention. It turns out there are a number of studies that show that what we're eating predicts mental health problems, predicts probability or predicts risk for the development of mental health problems. And I'm going to show you just two studies. One is in children and one is in adults. This one is in children, and it was done here in Canada, but published in Pediatrics, the lead pediatric journal for the American Pediatric Society. And it was done with over 3,000 children who were 10 to 11 years of age. And in 2011, they were all evaluated for 9 health behaviors, 6 of which were related to food, okay? The other 3 related to screen time and physical activity, other very important lifestyle variables. But 6 of them were on dietary intake. And then they were divided according to how many of those 9 health recommendations were met. And you can guess what they were, like a certain amount of screen time, a low level of sugar soda drinks, etc. Okay? But then the researchers went back a few years later. And because we have single payer system in Canada, they were able to pull the administrative health data and ask the question of who developed the need to go see a physician for a mental health care problem. And this is what they found. So in this bar graph, this is kind of a cartoon of the finding, but it shows that in this group where the kids met only 1, 2, or 3 of the 9 recommendations, they put that in as the amount of mental health care services that they were seeking. The number doesn't matter, okay? But this is, as I say, it's a cartoon. The point is to show the amount of protection from following more of those health recommendations. So those who met 4 to 6 of the recommendations, there was a 39% reduction, in the need for mental health care services. For those who met 7 to 9 of those health recommendations, there was more than a 50% reduction. I mean, what are we doing to our children, right? That's the thing that I keep asking. And then they did what's called a regression analysis, and they asked how much each additional health behavior protected the children. And they found that for every additional recommendation met, there was a 15% decrease in physician visits for mental disorders. That is 15% less suffering for the children, 15% less likelihood of early exposure of developing brains to psychiatric medication, 15%, benefit to our healthcare budget, and nothing to lose except just protecting our children. Now let's go to the study on adults. We're all concerned about the risk of suicide, okay? And diet is a risk factor for suicide, of course, because of the link to depression, which we're going to talk more about. This is a study from Japan that was published in the British Journal of Psychiatry. And I'm just going to show you a little bit of it. It was launched in 1990. They followed about 90,000 adults. And at baseline, they evaluated a lot of things, smoking, drinking, etc., and also their dietary habits. And then they had government records for cause of death, and they followed them for at least 10 years. And what they found is that one type of diet was associated with a reduced risk of suicide. So because this is prospective, longitudinal, it's no longer just correlational, it's really showing a causal factor. And this is what they found. They called it a prudent diet. It's kind of a value-laden term, but it's the most similar to what we might call a Mediterranean whole foods diet with kind of a Japanese twist with, a lot of soy and mushrooms and fish. But it was the people who followed that kind of diet had only 50% of the risk of suicide of people who follow various processed food diets. That should have an impact on our healthcare system. It should say something about what we should be teaching people who show up for help for depression, but it hasn't filtered into our policymakers' heads yet. So I'm going to move on to the third kind of research now. So we've shown correlation, we've shown prospective predictability, which means causation. And now we're going to show two kinds of treatment data. This first one is, there aren't that many studies on this. They're kind of harder to do, and you can't do a placebo-controlled trial. These were done by 3 different groups where they took people with depression, taught them how to eat a whole foods Mediterranean style diet, and randomized the comparison group not to a placebo, but to an active, we call it an active comparator, where they were getting dietary peer support. And those are the references. And I need to just pause and say, do you know what I mean by a Mediterranean diet? Maybe you don't. So this is not a Mediterranean diet. This is the Western processed food diet. And we laugh at it, but it is hurting people without a doubt. And this is a Mediterranean diet on the next slide. So I'll just review it with you. It means that you have a lot of fruits and vegetables, fish twice a week or so, if you eat fish. If you're not a vegetarian, some lean meat. If you're not a vegan, then some dairy and eggs. If you're not avoiding gluten, then whole grains. You can see how you lose a lot of this on restrictive diets. Nuts and seeds, great snacks. Olive oil for the oil that you do consume whenever possible. And this we're going to come back and talk about in a few moments, and that is beans and legumes. So that's the Mediterranean diet, and it didn't look at all like that, did it? So ask yourselves what our university students are eating, from here or here. Is it any wonder that there's such a peak onset of mental disorders at that age? I think not. Okay, so here's the combined results of those 3 studies where they were taught to improve their diet. There was a decrease in depression and no side effects. Of course, when you eat your diet, the only better diet, the only side effects are generally improved sleep, less constipation, feeling more energetic, etc. So it took just 3 weeks using an online educational video to achieve a 25% decrease in depression in one of the studies. In another study, this is kind of interesting, I think. 8% of those who received peer counseling went into remission. That means when you talk to your friends who are struggling with mental health issues, you're important, and what you say to them is important, because 8% of them no longer met criteria for depression after 12 weeks. That's impressive. But 32% of those who learned how to eat better no longer met criteria for depression. And if anyone has ever heard of an antidepressant medication that can do that, please let me know, because I certainly haven't. So why don't we do this for every clinic? I don't know. Anyway, so a whole foods Mediterranean diet is also cheaper than a habitual diet. If I ever give a talk where I don't tell people this, I will kick myself, because there is this myth out there that eating a healthy diet, my patients can't afford it, or my family can't afford it. And that is not the case. As they showed in this particular study, the weekly cost of food actually decreased. Now, this is in Australian dollars, from a processed food diet to the period when they were taught a Mediterranean diet. They actually saved money. And this is why I said I'd come back to the beans and legumes. If you want to live on much less money, learn how to cook with lentils, which are very fast, and all the dried beans and legumes, or if you must, you can buy them in cans. It's still very inexpensive. Just rinse them so you don't get all that sodium. But learn how to cook from these dried beans and legumes. There are literally millions of recipes. Well, some in our book, I should mention that, but millions of recipes online. And it is an enormous cost saving for everyone. And you will be healthier, of course. And I'll leave it to the dietitians in the audience to talk about which nutrients are in each one. I can't go into that here. So what we've covered so far, and it's been about 20 minutes. Good. It's amazing how much we've covered so far, but I'm not done yet. First of all, it's been known for at least 70 years that eliminating 50% of the micronutrients in our diet results in depression, anxiety, and inattention. That's very solid data, and it's not attended to. Canadians and other countries too have chosen to cut 50% of their micronutrients by not eating real food, by cutting their intake of real food and replacing it with ultra-processed products. I can't call it food, forgive me, okay. But it's now in the literature, it's UPFs, so ultra-processed food. Now, I haven't mentioned this, but you probably know there's an epidemic of mental health problems. You know, in 1960, it was, we have these numbers laid out in the book, but in 1960, it was generally less than 1% of the population at any given time was experiencing a mental health challenge. Now it's 20%, and there are some good reasons for that increase. We know that people are more likely to come forward now and look for help, and we want that. But I don't think anyone thinks that that explains the magnitude of the increase. And this is an absolutely ridiculous statistic, but according to the world, I mean, ridiculous in that it's horrifying. But according to the World Health Organization, lifetime prevalence is 50%. And if you had told me that when I was in school in the 1970s, I just would not have believed it. How could 1/2 of our population have a mental illness at some point? Makes no sense. I've already shown you more than 12 population epidemiologic studies showing correlation, association between diet and mental health. And again, we don't need to do any more of those. And the predictive studies show that better diet is a protective factor. It can prevent mental health diagnoses and protect us from suicide because it protects against depression. There are other studies that show that too. Nutrition education results in better treatment effects than any antidepressant medication ever in 3 independent studies. A whole foods diet can save people money and will also have an impact on our the pockets of our taxpayers. So why isn't nutrition part of every conversation on mental health? What's it going to take to get policies changed? And to me, the answer is education. I'm hoping that you're feeling empowered by now, because these are things that we can do. There's no magic here to improving your diet. It just takes determination. So what nutrients do in our brains? We should have been taught this in elementary school. Our doctors should have been taught it in medical school. And unfortunately, it's just not there yet. Our brains account for only about 2% of our body weight, but our brains suck up anywhere from 20 to 50% of the nutrients and oxygen and everything, but certainly of the nutrients that we consume. So why would that be so? And this is what is not taught very much, and that is the basics of metabolism. Metabolism is a very simple concept. It's just the transformation of one compound to another. And in the way our physiology works, it is usually an enzyme that is needed to get from chemical A to chemical B. But enzymes cannot work alone. They are dependent on us providing them with an adequate supply of cofactors. And some of you have probably never even heard that term, cofactors. Cofactors include usually the minerals and vitamins. And I'm going to show you one slide which explains it all. And to keep you motivated to pay attention to this slide, I just want to say this. I have been told repeatedly at the end of talks, people have said to me, Bonnie, I'm not going to remember anything else you say, and I'm not offended, but I'm going to remember that slide because it's going to influence the way I eat. So get ready for this. It is a tiny little portion of a metabolic pathway, including some things you've heard of, like here's serotonin, here's tryptophan, here's melatonin. And so each of these arrows is an enzymatic reaction, and each enzymatic reaction, I just told you, requires cofactors. So you can click on the arrows and ask what's needed in each case. So here, to get from tryptophan to this chemical, you need iron, phosphorus, and calcium. To get to the next chemical, you need vitamin B6. And over here, you need B6, riboflavin, and iron, etc. Vitamin B6 there. B6 is a very important vitamin for the brain, not that the others aren't. And so we continue in every single step. Over here, we need zinc for the breakdown of serotonin. And here we need iron and niacin, and every single step requires micronutrients. So what do we take away from this? Number one, you have to be bathing your brain in micronutrients at all times, every day, all day and night, to feed these pathways. If you want your neurotransmitters and so forth to be working properly, to be communicating, for the breakdown to be having, etc., you have to do that. And that means eating a healthy diet. But in addition, notice that there's no single magic ingredient. So if someone says, oh yes, I think you should take vitamin D, and well, I guess D is not on here, copper and B6. Well, that's fine. They're important. But what about your riboflavin? What about your molybdenum? Have you had that today? What about your iron? Every single nutrient is important. There is no magic bullet. So let's go on. Now that I've shown you that, this just came out this week, so I thought I'd show it to you. It's the best picture ever published of a single neuron. That's this here in kind of the turquoise color, showing 4,000 approximately nerve fibers connected to that single neuron. That means like 4,000 steps, communications. We have about 100 billion of these in our brain. So think about how very tiny my serotonin diagram was, very tiny compared to what's happening for every single brain cell in your brain. And they all need micronutrients. So the bottom line is the role of micronutrients in the brain is not a mystery. Nutrients are cofactors that should be taught to everyone. I don't have time to go into mitochondrial function or inflammation, but you can tell a similar story there. And I have a review article here if you're interested. Let me know. I have to show you the fourth type of research, and that is also treatment research, but it's treatment with nutrients in pill form. I don't like to call them supplements, but I will. The reason I don't like to call them supplements is, to me, it should be primary treatment. Nutrition should be primary treatment. Medication should be the supplement. Think about that. Doesn't it make sense given what I'm telling you? Anyway, what about people who already eat a really healthy whole foods diet? They're getting a lot of healthy food. They're getting vitamins, minerals, essential fatty acids like the omega-3s. Is nutrition relevant for them? Well, there's good reason to think that it is. First of all, we know about individual differences. So you might need more phosphorus than your sister, who needs more magnesium, and your brother needs more iron than typical, right? Just even in your own family, there might be individual differences. And we have no way of knowing that right now. So there is no test that can tell us what an individual brain requires for optimal function. So when you get those blood tests, I'm not saying you shouldn't have blood tests. There's a lot that your doctor might want to know about your health and nutrition from blood tests, but it's never able to tell you what you have relative to what your brain needs. So a good diet might not be sufficient for optimal brain function, partly because of the problem we're having with depletion of the nutrient content of our soil, the mineral content. And I don't have time to go into that today, but that's chapter 5 in our book, the human and soil microbiomes. Excuse me. I don't want to break everyone's eardrums, including the people who listen to the recording. So finally, about these studies using nutrients in pill form. Well, there are tons of them, many good studies. You should ignore the ones that study single nutrients. You're never going to touch significant mental health problems with a single nutrient. There are some favorite few studies which are useless also, because people just kind of say, well, this is good for the brain, this is good for the brain, let's put them together. But you should ignore those. But B complex is a unique category, and I'm going to come back to that. Our brains need a lot of B complex. They need a lot of, that's the dark green, leafy greens that you're consuming every day, I hope. And there's something different about the treatment with B complex. But for frank mental disorders, I think the only beneficial treatment has been broad spectrum. And there are around 50, I think, articles on broad spectrum formulas now. And that means roughly the 15 minerals that should be in our soil and the roughly 15 vitamins that our crops should be synthesizing for us. This is a summary slide. I can't go through 50 or 60 studies for you. So this is a summary slide that Julia put together a while ago, and it's still completely true. She just looked at how many randomized controlled trials had studied aggression and found at that point in time there were 5, and all 5 of them showed the benefit of a multi-nutrient broad spectrum treatment. For autism is unique. Addiction, there are only a couple, but we need more. Mood, stress, including B complex, etc. The common theme is, first of all, in controlled trials, we have very strong data, 81% positive trials. And most of the negative ones are not done in people with mental disorders. They're done in like college students without actual mental disorders, which they're handy to study, but they're not appropriate for this. But there is a common theme, and that is emotion regulation, lowering irritability, managing anger. I always used to say when I was doing studies, show me a child where the parents say, living with this child is like walking on eggshells. And that's the child I want to see treated with broad spectrum micronutrients. Okay, just pointing out it's relevant to COVID. And I'm going to skip over this. This is the, I can't skip over it totally. Okay, we have a whole theme of research that Julia Mosley and I have done, showing reduced stress following the earthquakes in Christchurch, the flood in southern Alberta, and then the mosque massacres back in Christchurch. And I'll just quickly show you what we found. This horizontal line is defined as the cutoff for clinical symptoms. So on depression, anxiety, and stress levels in people following one of the earthquakes, treated with a broad spectrum micronutrient formula, in 4 to 6 weeks, they were down below clinical cutoff. They were in the normal range. In the flood, I couldn't believe it because they had 8,000 aftershocks. Excuse me. We had 1 flood in 2013. We found exactly the same thing. And in the mosque massacre, with clinical observation of people following the murders of the people in the 2 mosques, same thing in 4 to 6 weeks. The comparator, which was treatment as usual, this is what our psychiatrists who are trying to help these people are able to do. And in 4 to 6 weeks, they are not in the normal range following the earthquake or the in the flood. The comparator was vitamin D. And I wanted to show you the Alberta flood, not just because I think a very significant portion of this audience is in Alberta, but also because it tells the B complex story in an important way. In our study, people did not have any mental disorders prior to that flood if they were in our study. They were excluded from our study. So this is a general population study. And what we showed is that people who were given either B complex, the red line, or a broad spectrum formula, the green line, in 6 weeks were in the normal range. That's phenomenal that they did so well. Our comparator of vitamin D, they did not come down into the normal range. And so what this says to me is you can't, no one has ever thought that B complex gets rid of a mental disorder, bipolar, anxiety, etc. But in the general population, we could be alleviating a lot of suffering by telling people who are going through a crisis, widowhood, a flood, massacre, no matter what it is, if they would just take a B complex every morning after breakfast, it will help them overcome that stress. So I call it the unsung hero for the general population, and I give you some references here. And the alternative, we actually have the alternative in Alberta. after the Fort McMurray fires, they would not let me educate the people who 90,000 people were displaced from their homes. They would not let me spread any information about B complex. Psychiatry blocked it. The dietitians blocked it, I'm sorry to say. And this is what happened after the Fort McMurray fires. This is the point of Fort McMurray fires. This is mood disorders. This is anxiety disorders. And they went up instead of going down over, over the month. So it's very sad. It should be part of public health, and it's not there yet. So what should we be doing? Teaching people those metabolic pathways, teaching them to think about it, and children can understand it too. I'm just winding down here. In case Justine's concerned about time. What should policymakers be doing? I think every mental health clinic should provide nutrition education at the time of first referral. I haven't gotten any clinic to do that yet, but I'm optimistic that we're on the verge of it. And I'm not talking about a course in nutrition or a referral to dietitians who, as I told you before, are my heroes, but we would have such an impact if we could just teach the difference between real food and ultra processed products. As Michael Pollan says, eat real food, mostly plants, not too much. It's a great way to live. How and why to improve dietary intake for brain health. If we don't teach why, people are not going to change. Maybe cooking classes could be organized, and we've got to get rid of this idea that fast food is cheaper. It's not cheaper for the individual or for our healthcare system. These are our chewable vitamins and minerals. And this showed up in my Safeway a couple months ago. I was fascinated because I eat an apple first thing every morning. Every day, Canadians are wasting tons of apples. We should, instead of that sign, we should have a sign in every produce department saying, get your prebiotics here. Feed the healthy gut bugs by eating the stuff in your produce department. So now, I feel I talked a little fast. I apologize for that. Also hoarse, and I apologize for that too, but can't do anything about it. I think you should know now why your brain needs nutrients to function properly. I think you probably understand the essential role of micronutrients in mental health. And I think you understand that the evidence base linking mental health to nutrition is now vast and should influence our policymakers to improve treatment. And again, I'm back to the why. That's why I decided finally I did have a book inside me, but we also have some review articles here. I will hand out these slides to anyone who wants them. I don't expect you to jot this down or read them, but there's one for mental health clinicians in particular that's already very highly cited. One for people particularly interested in the massacre, earthquake, and flood data, and then for people interested in systematic reviews. And this you need to write down. If you're interested in a MOOC, these are the massive open online courses that Harvard and MIT started, I don't know, 10 years or so ago. Julia's University of Canterbury got involved in doing MOOCs. And so she did one on nutrition and mental health. Go to edX.org and search for just her last name, and you can sign on for a free course, lots of 6-minute videos, goes into stores with you, very user-friendly, and there's a new series beginning in August. I recommend that. And of course, I recommend you read our book, and I know some of you are doing so. There are also videos and tips for clinicians on my website, and also a link to Julia's TEDx talk that almost 2 million people have watched. So I'm going to open my screen again so that I can see all of you. Shall I leave that up or stop sharing it, Justine?
Yeah, I think you can leave it there. That's great. Then people can take a look at the different options, and we're happy to email if you wanted other links or anything available as well.
Okay. I look forward to some questions.
Yes, thank you so much, Dr. Kaplan. I always love hearing you speak, and I always learn so much from you. It is such an honor to hear all of the work that you've done, and I know how much you've helped a number of people as well. It's always just, I think the big picture is truly the impact that real food can have. and just how ultra processed foods are taking over. And it's so sad to see that. So thank you for all the work and advocacy you're doing in that area. So number one, we've got time for questions. I've got a couple coming in through here. And if you want to win a copy of the Better Brain book, we do have an Instagram giveaway going on. So you can join us on there, and we'll be giving away 2 copies tomorrow. So just follow myself and Dr. Kaplan and you can see it there. And I'm going to have a couple of questions come your way now. So we've got one from a little way ago. Question from the slides about 50% ultra processed foods. Does the fortification of these foods with vitamins and minerals make a difference? There's precedent for the efficacy of supplementing foods, iodine, salt, folate. Could fortification of processed foods be a public policy strategy?
Sure. And thank you. This is from Dr. Pendergast. I'm so, Grass, sorry, I mispronounced your name. I'm so delighted you joined us. I'm glad you raised the issue of fortification. How could anybody be opposed to fortification? Fortification is better than not fortifying. And certainly like in the neural tube defect world, it's made a big difference providing the general population with folate. However, have you ever seen a product which has been fortified with roughly 30 vitamins and minerals? I don't think so. And omega-3 fatty acids? I don't think so. So it's not that it's bad, but I don't think it's adequate. And I think the proof is in the pudding. There is no question that, I mean, if you're going to make fortification of processed food with the whole spectrum of minerals and vitamins an issue, then I don't think the manufacturers could be making the huge profits that they make with ultra processed foods. And I don't think it would fly. So the doses would be too low and the range is too narrow to consider it to be a solution. I hope that answers your question. If not, email me later.
Okay, great. Another person looking for a quick handout that may be available to a clinic to convey this information as effectively as you do.
You know, I have thought about preparing a handout for a clinic. And if this individual would like to work with me on it, email me. You can do that through my website, because I think it would be great to have a handout that's summarized. I don't know where to draw the line. I'm not a clinician. I've never worked in a clinic, and I would make it much too long and much too wordy. But if we could have some kind of summary with some resources available, I'd be happy to work on that.
That's a great idea. Thank you so much. I think that could be really helpful. We have Terry asking, how do we identify what additional micronutrients we should eat or take in pill form?
So I'm often asked this question in a slightly different way, Terry. People say, well, which is the important one? and I that's kind of what you're getting at. And my answer always is, there is no one important. The question is wrong. First of all, when you eat whole foods, which are nutrient dense, which is a whole other topic as to whether we're getting that anymore, but you are not only getting roughly 15 vitamins and roughly 15 minerals, you are also getting possibly over 1,000 phytonutrients, many of which do not have names yet. They're plant-based nutrients, things like, you've heard of some like lycopene, which we think are probably important for us. Many of them don't have names. Most of them, we don't know what they do for us. And so we have evolved to need them though. I mean, we've evolved to need these plants. So I recommend that you consider getting the biggest breadth that you can. How do you identify which ones you should consume? I would say all of them, as many as you can. I hope that makes sense to you. If not, we go into that in greater detail, both in our book, and there's some other stuff on my website relevant too. Excuse me.
Thank you. Dr. Kaplan, Sharon says she's a huge supporter of this research. Many people think that taking vitamins supplement, not eating healthy. Any comments?
Yeah, you're fooling yourself if you think that you can continue eating I don't call it junk food often, but that's what we're talking about. Nutrient-free food, food which is not, it's just filling up your stomach and probably giving you some pretty unhealthy fats. If you think that you can continue that way and just pop pills, I think you're deluding yourself. If you truly want health for both your brain and your body, you really need to avoid the ultra processed food. And I'm not saying never have a cookie or whatever, just, switch your diet to emphasize a whole foods diet. Absolutely the way to go.
Thank you. You mentioned omega-3s earlier and other fat micronutrient replacement pills. Can you comment on ADHD management and omega-3 fatty acids, EPA versus DHA ratio specifically?
So I'm going to answer this a little bit generally. I'm much more knowledgeable about minerals and vitamins because that's what I studied, more so than the essential fatty acids. And there has been the assumption for a long time that babies need a higher ratio of DHA, and by the time you're an adult, you need more EPA. And now recently someone told me that there's research coming out that disagrees with that. So I can't evaluate that. I can tell you that if you look at all of the money that's been spent on the essential fatty acids for the treatment of mental disorders, it makes me envious. If only a tenth of that money also included the broad spectrum of minerals and vitamins that we need, we would be so much further along. There's something about the public imagination that was grabbed by the essential fatty acids. Nobody is disputing their importance. I mean, our brain cells are dependent upon the omega-3s and having the proper ratios, etc. We absolutely, our cell walls are dependent upon that. But why would we study that in isolation? I just don't get that. And so for management of ADHD, the research I think is stronger for the broad spectrum micronutrients. We have randomized controlled trials from Julia Ruckledge, and this is covered thoroughly in our book, for adults and for children. And now we have a third trial in children, Micah, which is specifically to replicate all the other ADHD studies. And it's a multi-center, multi-country study. And I can't say more because it's in revision. If you know what that means, it's about to be accepted, but they don't have the letter yet. So watch for that one, okay? Sorry, I think I covered a few things there.
No, it's all so helpful. Pam says, what to look for in a supplement if the gut has been damaged from years of undiagnosed celiac, so digestion, absorption isn't great?
Why don't you answer that, Justine?
Well, I also am not a clinician, so I cannot make clinical recommendations there. But I think that it's important to talk to a local dietitian about that and look for ones with the least amount of additives would be the main things that I'd look for, and a reputable company that actually researches it and isn't just kind of the generic brand that may or may not do the research about what they put into the supplements. I know that's a whole other topic in and of itself that you've talked about before as well, Dr. Kaplan.
Yes, I keep calling you by your first name and you're being formal with me.
Please. Oh, Bonnie.
Okay.
Okay.
We should have sorted that out before the recording started. Okay. So yeah, what Justine is touching on is something that I often talk about, which is I'm an academic snob. And so when people ask me which formula they should look for, and this isn't particularly relevant to Pam's question with gut problems, but just in general, which ones, I usually say look for ones which have been studied by people who are not funded by the company. And that's why the majority of the research on broad spectrum formulas is on the two that were developed in Alberta. And most of you on this call probably know about it, but that's in chapter 11 in our book. We review all of the multi-nutrient formulas in the world for which there is research coming from people who are not funded by the companies. That's really important to us because, well, I'll speak for myself and not Julia. It's important to me because what I saw in my lifetime was the corruption of the mental health treatment world by researchers becoming funded by pharmaceutical companies. Something that was considered to be unethical when I was in training became the norm. And I think that's really sad. And it's one of the reasons why those of us studying the 2 Alberta formulas are not accepting any money or any financial involvement with those companies. We don't want this research to be tainted in that way. And as I always say, if you have a good salary, it's easy to have integrity. So that's coming from someone who had a university salary, right? Had to throw that in. Okay. It is. And I mean, it's a real problem, I guess, if people need the money, but they shouldn't be taking money from companies.
Mm-hmm. So chapter 11 of your book has a lot more information on that. Thank you. Joanna asks if B vitamin supplements, are they effective for individuals continuing to consume ultra-processed foods?
Well, no one has taken a group of people who are consuming ultra-processed food and given them B vitamins under controlled conditions that I know of. So there's really no answer to that question, but it's all I can say is, why would you do that? Again, it's not going to hurt you, but I think it would be wise to improve. I'm a diet first person. We evolved to need the nutrients from a healthy variety of crops. That's, from either the plants that are absorbing the minerals from the soil and synthesizing our vitamins, or from the animals that come along that eat those plants. And we are cheating ourselves if we don't begin with an improved diet. My research was on nutrients in pill form. So obviously, I think that that's important to look at too, and also important clinically. But why would you cheat yourself by not beginning by improving your diet? I don't get it.
So I wonder, I know there's lots of comments coming in, but just to follow up on Joanna's comment, I wonder if, I know that there are many dietitians on here who work with kids who probably are very picky eaters and have a very limited diet. So I'm wondering if the question, and I'll skim down to see if this is the clarification. So if you're working with kids with ADHD, autism, and they won't eat other foods, if starting with the B vitamins would be beneficial.
Possibly. I mean, people might actually feel the difference. Some people report feeling it really within hours. They take one, by the way, just a chance to say this, never take any of these nutrients in pill form on an empty stomach. So you've eaten your breakfast, then take a B complex. Don't take it at night, because B vitamins are very energizing for some people. Some of the rest of us, I could take a B vitamin and go to sleep, but a lot of people can't, right? So take a B vitamin after breakfast, regardless of your diet, and see if you feel anything after a week. That it's not a bad thing. I like this next one. May I?
Yes. So I think this is actually what I kind of was just saying. Sorry. Yes, the proof is in the poop.
In the poop. Yes. Thank you.
Of course, we've got to talk about poop.
in Saskatoon. Yes, absolutely.
Grants in Saskatoon, you are a wonderful woman. Thank you,
Yes,
Judy. And so I know we're going a little bit over time. You're okay to keep going, Bonnie?
I'm all right. And if people can't stay, that's okay. I saw so many people coming in late, but you all know you'll get the link later.
Yes. Yeah. The recording's coming as soon as we get that together.
Right.
So the next comment actually is kind of exactly what I was guessing might have had to do with the question. Yes. So this participant says, our son has severe ADHD. He's an extremely selective eater. We endeavor to provide healthy foods, but he's resistant. How do we support him? We walk on eggshells. Our psychiatrist is resistant to this research on nutrients supporting mental health. I know this is probably a full hour talk in and of itself, but anything you can help there.
Yeah, thanks. Okay, well, first of all, I think it's page 279. We talk about the picky eater. Well, I've recommended it to so many people. I'm very familiar with the picky eater phenomenon. And what we have there is the thank you bite method that, I don't know how old your son is, but I strongly recommend that you start it. So, and if you can't get the book or something, I'll write it out for you some other time. But you can, with repeated presentations of food, train children to eventually accept a broader diet. The problem is the way you present it. And that's what the thank you bite is about. This second part of the question is so important. Our psychiatrist is resistant to the research. it's because they don't know about it. That's why we wrote our book. Give them a copy of the book. Give them the link to my website. I mean, I'm not just promoting a book. I'm wanting to change the educational level of people. And so I don't understand why, but psychiatrists have in fact been a very large obstacle, except for those who are trained in integrative psychiatry and the functional medicine people. They know that this is all completely sensible and and real. And our book is evidence-based. And if people go to the trouble to read it, that can sometimes change their minds. But I don't know what else to tell you. If you would like to email me separately, there might be something else I could help you with. I'm not a clinician, but I'm always willing to talk to people one time with email or occasionally a phone call to see if I can set them on in a direction. Okay. The fact that you're living with the walking on eggshell phenomenon means I might have something else I could talk to you about. Okay.
Thank you, Bonnie. And I know that there are actually some dietitians on here who are familiar with your work and really are that specialize in ADHD and using food and nutrient supplementation. So number one, if you're a dietitian who specializes in that, email me so I can have your name as a reference to connect people with. I'd love to connect with you. And so that we've got some different resources to help people, because my guess is that there are a number of people in that boat that who are here today. Okay.
So Justine, I think I can read these now. I'm back
sure,
online,
great.
if you don't mind. So
no, of course.
Dr. Karen Glickman would like to know, how do you keep moving forward? Karen, it's with a thick skin. My research was halted by Health Canada because I was studying those dangerous vitamins and minerals, which is just baloney when you think about what we're doing to our children with medication first. I'm not anti-medication. It just should be the supplement, as I said. But what keeps you going is when you see lives transformed. Okay, and I know that Julie would tell you the same thing. That's what keeps us going. This is the person who wants to work on a clinic
summary
brochure.
sheet.
So yes, so email me, okay, Lydia. Joanna, research was done years ago with children consuming, the coloring agents. Is this still a problem? I did, I think, the first completely blinded randomized controlled trial on that very topic, the so-called Feingold diet, and published that in Pediatrics in 1989. That was before I gave up studying nutrition and then went back to studying nutrition. At any rate, it's amazing. But here's the problem. Even in that study, I cannot be sure that the children who improved so much when we got rid of the additives, whether it was the removal of the additives or the fact that when you remove food with additives, what are you replacing it with? You're replacing it with whole, healthy food. And so there's a bit of a confound there that no one has ever sorted out. But definitely children who move to a healthier whole foods diet, there are, of course, fewer artificial colors, etc. There is evidence that they get better.
Sorry, just before you move on to Karen's, there was a direct message from someone to me that says, where would I find a recipe for balancing soil nutrients?
A recipe for balancing soil? Is this from an agricultural person?
From Jim Porterfield.
Oh, Jim. Okay. I'm swayed by Harvey Dan and you, Jim, to look at the Albrecht method, but I don't have a recipe. If anyone would, it would be you. Email me, we'll talk. Okay.
Okay. And there's a resource for the person whose son has ADHD.
Yeah.
A couple of resources there. So I'll make sure to include those. But thank you, Karen.
Thanks. Question about vitamin supplementation from Jenny. Vitamins are half the equation. Minerals are as or more important. I agree. Also, OTC formulas include limited minerals and at low doses. I agree. I'm not sure which Jenny this is, but I think I know. RDA, DRI are based on physical needs for healthy individuals. These are very important points. And that's why CDC, I wanted to talk to you possibly about walking on eggshells. Sometimes you can do something as an initial step with liquid minerals, because we have seen some people temporarily get better on just the mineral component. The fact is we need them all together in balance. Jim, just the way the soil needs all those minerals in balance. Okay. So thank you for those comments, Jenny. And thank you, Kara, for your comments. Well, can you suggest accessible resources for college-age students? We have a little section in our book about college-age students because it's just appalling. Everybody should just ask their college-age kids, what are you eating? Ramen is the word I couldn't think of before. They live on ramen and pizza and soda and beer. You should now know that depression and anxiety are predictable. Somebody needs to do a study like that with that group of people. But the accessible resource, I'm not exactly sure how to answer you. It's all a matter of education. Do we need a handout for college students too? Maybe. I'm very concerned about them. Teresa, what would be a good response for those who are concerned about getting too much of a certain micronutrient? Well, Teresa, as you know, because you're an expert in nutrition, the vast majority of the nutrients that we consume are water soluble. You pee out the excess. None of the studies have ever been done with a mega dose, a dangerous dose. The space in the DRIs, dietary reference intakes, the range between the RDA, which is pathetically low, and as Jenny pointed out, is just for healthy people, physically healthy people, and the UL, the tolerable upper level, where there has been a reported adverse reaction, is gigantic. And all of the research I've been talking to you about and anything you would be getting from eating a healthy diet is in that safe range. So maybe, Teresa, if you want, actually it's in our book, but I can send you a slide if you want, just remind me, showing you the distance between the RDA and the UL. Watch Fast Food Nation, Jenny. Liver and kidney enzymes high after 30 days on fast food. Okay. Thanks from Grams. Dr. Pendergrass had to leave. Danielle, have to log out. People are saying goodbye and thank you. That's nice. Is that it?
I think that is everything. So thank you so much for your time, Dr. Kaplan. Bonnie, it's such a pleasure to work with you and for answering all these questions. So people can go to your website for more information. If you want to win a copy of Dr. Kaplan's amazing book, Dr. Julia and Bonnie and Julia, so can't forget her, of course.
Right.
Please, you can, again, join our Instagram giveaway. We'll be emailing tomorrow with the winners. And if you have resources or other connections, send me a note and I will do my best to provide that to people who are looking for support as well. So again, thank you for your time. It was such a pleasure to have everyone today. The recording will be coming later today, and we look forward to being in touch in the future.
Okay. Thank you, everybody.
Thank you.
Thanks, Justine. Bye now.